Hi, this is Dr. Barron with High Point Spine and Joint Center. I wanted to make a quick video for you about your diagnosis of cervical disc degeneration or arthritis in your neck, and try to explain a little bit more about what it is, what can cause it, as well as what some of your treatment options are in our clinic and what we can do for you in the office and what you can do for yourself at home as well. So, cervical disc degeneration comes on with age in most situations. And as we age, we get some wear and tear on the disc, which are the cushions between each vertebra in our neck. And they can become progressively thinner over time. And with this cycle of thinning and wear and tear, they can become arthritic with some bone spurs, and even can create some narrowing in the holes where the nerves come out, what we call stenosis. Over time, if it gets progressive enough and irritated enough, it can create kind of a pinching of those nerves in that opening, which can lead to some tingling, some numbness that radiates from your neck into your shoulder, sometimes down into your arm and hand. It's a very common problem. About half of all of the population is going to have some of it by the time they're 40 years old, and up to 85% of people who are 60 are going to have some of this cervical disc degeneration and arthritis. Men are slightly more susceptible to it than women, but anyone can get this as we get older and as we have some wear and tear on the joints and disc within our neck. One of the few of the things that we can do in the office that can help is using some joint manipulation or some adjusting to try and get those thinned out discs where they're restricted and stiff, try to keep them moving in a good biomechanical function, moving efficiently so that there's not as much spasm, stiffness, inflammation in the joint. It helps to unload the areas that are restricted all the time. And so it can be very beneficial in helping with arthritic changes and degenerative changes in the neck. We also utilize different types of myofascial work, whether it be dry needling, where we insert a thin monofilament needle into the muscles around the neck, the tight muscles that are spasmed or really stiff. We can insert the needle, run a little current through that muscle to help it to fire correctly. By getting it to fire, then we help it to relax and reset, and can be very beneficial in these chronic conditions where you always have this muscle stiffness, tightness, along with the spasm. There's also different therapeutic rehabilitative exercises that we can show people how to do. Those are very important in strengthening up certain muscles, helping with muscle tone and balance that can take away from some of the pain that you're having. We also utilize a spinal decompression, which is kind of a decompressive traction where we hook you up to a device that's kind of a computerized winch system where it pulls on your neck, and it kind of pulls and then relaxes and oscillates between that positive and negative pressure. It can help beef up a disc that's too thin. It can help pull in some disc material that's bulging out or protruding, and that helps to with the integrity of that tissue. And it can really help open up some of the hole where the nerve goes out, open up and give you more space that can help hold your adjustments better and alleviate a lot of your pain and your swelling that you're having. There's also some things that you can do at home. One of the biggest things is kind of evaluating your habitual patterns and postures. So if you're sitting at a desk a lot, you're sitting in a chair a lot, you want to make sure that you're doing that with good posture. So if you're at a desk, I tell people, make sure that your monitor is about an arm's length away from you. The screen is about 15 degrees inferior to your eye angle. making sure that you're sitting up with nice, good posture while you're working. It's important in older individuals who tend to fall asleep in their chairs to make sure their head's not kinked off to one side while they're asleep. You want to make sure that you're trying to sleep in bed as much as possible. If you are falling asleep in the chair, make sure you have some sort of a pillow or a propped up position so that your head is in a neutral position while you're sleeping and you're not kinked off or leaned off to one side. You want to make sure that you have a good pillow that supports your neck and your upper back and your head properly, as well as just making sure that you're moving, that you have some good activity, that you're not too sedentary. The more we can move with these disc disorders, the more that we can keep mobility in the spine and in the neck and in the disc, the better they're going to heal up. So movement's key, exercise is key. Making sure that you're compliant with some of the exercises that we give you to do. That compliance is key in helping to strengthen up certain weak muscles, helping with muscle balance, stretching certain muscles, and again, maintaining this movement that we need in your neck. So I appreciate you listening. I hope this video was helpful for you. If there's any questions you have, please call or text us. That's a good way to get a hold of us, and we can help you with that at any time. Other than that, we'll see you at your next appointment. Thanks.